Hi, welcome to this installment of 52 in 52, in which I'm interviewing 52 Wisconsin experts and rolling out their thoughts and cost-effective ideas to Wisconsin employers over 52 consecutive weeks. What we're going to do today is I have Dr. John Friedrichs from ChiroNut, and he has a very interesting program that he's rolled out over the last 6 months. And we got in touch because he's working with a client that I used to actually service. And so he came in and actually showed me his presentation, and I thought it was, I think it's pretty cutting edge. I've heard of no one else doing this. It's of no cost to employers, which I think you'll be interested in. And I think it's very good from a wellness standpoint. And my current push is to use wellness to impact workers' compensation. So the more healthy people or employers are, the better we're going to perform on the work comp standpoint. And together, we really want to improve the shelf life of what I call your workplace athletes. We have an aging workforce. I think John's program here will really be able to attack some of the fundamental problems of why people age, how they hurt, how they ache. So with that being said, John, if you could kind of introduce your background, and then I'll just ask you some questions that I think the audience may want to know some more about.
Sure. Thanks for having me. It's a wonderful opportunity to be with you and be here and share with everybody what we are doing. And I'm a chiropractor. I've been a chiropractor for 19 years now. We own a chiropractic business called Wisconsin Spinal Rehabilitation Center, along with my brother. We have 3 offices in southeastern Wisconsin. We've been doing it for a long time. Just recently, I just opened up and originated this company called ChiroNut, with the goal of helping employees stay healthier on the job. And I've been doing this for so long in my office, seeing so many people that come in with what we call crisis care, which is they wait until they have an injury, and then they come to our office, and then it's our job to help them get back to work and or get back on their feet. And that becomes a bigger, more intense effort to get people back to work after they've been injured. And the common thread that I've noticed with our patients over the years is that people that come in consistently, say once a week or twice a month or once a month, these are the patients or the people that tend to stay healthier. So you put that together with employees and employers that are dealing with injured employees or people that just have chronic conditions, and if you can develop a program, which we have now, that will help take care of employees on site for cheap, consistently care, they're going to stay healthy, and it's going to be a big part of the wellness program.
Okay. I've seen wellness fairs where there's a chiropractor in a booth, and I know his or her end goal is ultimately to get people to come to his or her office.
Correct.
This is different though, because you go on site.
Right.
And maybe you do a morning session and an afternoon session.
Right.
And this is all about wellness. This you're doing, as if I understand this correctly, maintenance treatments that are not billable to insurance anyway.
Correct. Yes, this is much different than a chiropractor coming into a facility to do a health assessment or a health screening. We want to prevent people from coming to our office. When we're busy enough the way it is treating crisis care, we would rather treat wellness care or patients that want to stay healthy, want to improve their health consistently. And doing a health assessment and diagnosing a condition at a health assessment and saying, okay, you need to come and see me, if a chiropractor were doing that, or a physical therapist, or whoever it may be, then they're going to come to the office and they're going to be treating crisis care and submitting it to insurance. This program, ChiroNut, is all about wellness care and preventing a condition from even developing, and we do not submit to insurance because it is wellness care. We are not treating a specific disease or illness or condition. We are improving the biomechanics of the spine, which will ultimately save and reduce injuries.
I noticed that one of the first things I noticed when I started doing these videos was, number one, my posture is terrible.
It's improving.
Number 2, I'm overweight, so this has become my new wellness program. And by the end of these 52 weeks, I promise my weight will be down. But you don't have to. I was thinking that you'd be great for some of my manufacturing clients, but actually you would be a good resource for just people that are behind a computer all day, because when I sit at my laptop, I'm like this, and I'm not hurting today, but 20 years from now, I could be in some serious pain. So you are treating office clerical people along with industrial
Absolutely. I mean, desk work, we thought when the introduction of computers years ago that was going to save in injuries. Well, really it's added to them, because the posture effect of sitting at your desk all day hunched over has led to more serious conditions. Posture, good posture is the key to spinal longevity. And if you don't have good posture in the workplace, you are susceptible to injury. And that's one part of the ChiroNut program that we do work with the employees with, is improving their posture. ChiroNut is about, ChiroNut stands for chiropractic and nutrition. And I'm a nut about chiropractic. I love what I do. But posture is really important in the workplace, whether it is manufacturing or sitting at a desk. If we do not have good posture, there's a lot of literature that will suggest, American Medical Association suggests in a study, that the poor posture is leading to many different illnesses and diseases, not just a matter of discomfort of joints, but other conditions as well. So if we can improve posture and maintain this proper biomechanics of the spine in a wellness format that is very inexpensive and convenient for the employee, then they're going to be better off. They're going to save time, and they're going to reduce injuries, and you're going to reduce the insurance claims and insurance submissions.
So if an employee, I'm putting back on my work comp hat, but if an employee comes to you and says, hey, I think I might have strained my back today, what is your response to that individual?
My response at that point, because it is wellness care, but I am a chiropractor and a doctor as well, so we need to analyze that clinically and determine whether or not that particular individual qualifies for a wellness adjustment or not. If they have a condition that is beyond wellness maintenance care, then they need to be referred either to the HR person or to the nurse on staff or to the PT on staff if they have one there. But they would not qualify for a wellness adjustment. They would have a condition that would warrant, more than likely, some more serious look at it.
So in a way, you can almost screen
absolutely
maintenance versus somebody who probably actually needs a file work comp.
Right, right. I mean, many insurances that we deal with, you know, if their scale of pain between 0 and 10, 10 being severe, and they're on a 1 or 2, then it's typically something that's manageable at home. So we need to evaluate them every time they come in, a brief exam, brief history of the person that's coming in for the wellness adjustment, and be sure that they qualify for this care. Mm-hmm. And people want to be healthy, they want to be productive. I mean, that's one thing I've noticed when I've gone into businesses, that they don't want to be sick, they don't want to be hurt, but they need a way to be able to improve their health, and being able to do that at work is very convenient. And they're happy to pay for it. The employees are. They have been. So because it's cheap, affordable, and convenient. And people want chiropractic.
So I see one huge benefit is I have so little time. I don't want to drive to Heartland to go see my chiropractor. Sorry, it's not you at this time, but I have to go to Heartland to see my chiropractor. So you're going to be there already. So right. that is a benefit to the employee. Right. Number 2, what is the cost to the employee?
The cost to the employee is just $25 for the adjustment. It's a private pay. It's $25, and we just take it right there, however they want to pay it. The employer has an opportunity, if they would like, to contribute to that. They don't have to, but they have an opportunity if they would like to contribute to the wellness aspect of their employees. They definitely can, and that's all worked out as well. But they do not have to. This is a strictly private pay wellness program, and people want it if it's provided to them, and they're educated about the importance of proper posture and proper spinal biomechanics. I mean, I can't say how many times when I've done the presentations at these businesses that they see these posture examples that I show, and they say, oh, that's me. That's exactly what I'm doing. Matter of fact,
I did it twice today.
Yeah, you just did it when we were talking. Yeah. Oh, that's what I'm doing. And we don't want to have poor posture the rest of our life, because when we get older, we'll be hunched over. And that's preventable. But it needs to be consistently given, that type of service, to help prevent that.
Okay. Explain, say somebody's interested, assuming you have an initial meeting, how is this rolled out?
The initial meeting, the first thing I would do is meet the employer or the HR person, and we sit down and we review the program together one-on-one. Here's ChiroNut, here's what it all entails, here's how it helps the employer, here's how it helps the employee, here are all the benefits of it, here's what it costs, and then we schedule a time for a lunch and learn or a presentation for the employees if that's possible. Sometimes that's not possible, just depending on the dynamics of the company. Manufacturers, they have 3 different shifts. We'd have to come at 3 different shifts if we were able to do that, which we can, and we've done. So But then the second day would be an evaluation of postural assessment of every employee. There's no charge for that. We use a program on our iPad, and we do a postural assessment and evaluation of their posture. And then the next time we come back, we review that with the employee, and we do a brief exam, spinal examination, and we give them their first treatment that day. And all along, the employees are informed about this through mass emails from the HR director, typically, or however the HR person gets messages out to the employees. Mm-hmm. And then we schedule bi-monthly visits where I come to the office or facility, and I am with the facility 3 hours either in the morning or 3 hours in the afternoon, or both if we need to, depending on the size of the company.
I think it's an excellent, I mean, I don't know of anyone else out there doing that right now. I do have some clients that have OTs or PTs coming in, doing something similar, but not from a chiropractic standpoint, I like that. I think what I'm going to do is I'm going to include below this video will be a link to some additional documents. One document will probably be just the benefits to the employer, then maybe some other documents about how the process is rolled out, just so you get a little bit more familiar with that. Is there anything you'd like to add before we sign off for the day?
I think it's been great speaking with you, but I guess one last thing, I want the employers to know that this should reduce submissions for insurance. It should reduce insurance claims, because the people that we are seeing are starting to utilize the chiropractic in office, private pay, and they're not going outside to their chiropractor outside and spending time, and then that chiropractor is submitting insurance for it. So it's going to reduce insurance submissions, definitely for chiropractic submissions, but also a healthier spine is going to lead to a healthier body, and that's going to improve health and wellness for that individual, which should reduce overall submissions for insurance, and really overall should reduce while the employees get healthier.
Hopefully they're happier, hopefully the morale improves at the company. I can see a lot of benefits coming from it. My one last thought is that from a work comp standpoint, official formal wellness program claims stemming from those are excluded. That you can deny claims that if you have a formal wellness program that says you can go outside and take a walk and they slip and fall, they can't file a work comp claim. So if John gets a little aggressive and does something, or if he just does it completely normal and somebody's sore, they can't file a work comp claim for that because it's part of a formal wellness program. So I think it's important to know that what your liabilities are with respect to this, and I think it's very minimal. He also has his own insurance, and you can have that discussion with him about additional insured status and whatnot. But I want to thank you very much for coming in today. I love the idea. I think it's new. I think it's creative. And if anyone has any questions, my contact information will be below on the newsletter, also on the YouTube video, and John's will be there as well. So you can reach out to him directly or go through me, whatever's easier for you. Thank you for tuning in today to this edition of 52 and 52. We'll see you next week. Have a good day.